Well, this is very much a cross-government effort, and no fewer than 6 government departments have been involved in the preparation of this paper and the options that we're putting before the country.
This Green Paper is a huge opportunity to have a fundamental debate right across the country about the future of our care and support system. We've never had a debate like this since the Health Service was created over 60 years ago.
Well, it's really important that as many people as possible contribute to this. Talk with your friends, talk with your family, but please send us your views about how we should be developing this service into the future.
It's enabled us to look at some big questions like, for example, what are the responsibilities of the state, of local government and the health service at local level, of the family and of the individual.
The system isn't working well and is in need of radical reform. What we hope is that the Green Paper will offer a range of options which will push forward radical reform to deliver a much, much better system of social care and care and support.
Well, the Green Paper has been built on the back of a huge engagement process where we spoke to the general public through deliberative events, but thousands of stakeholders over a 6-month period. They told us they wanted services which were fair, which were easy to understand, kept them healthy and well, services, most of all, which were bespoke to them. It met their individual needs and provided them with choice and control.
In the past, older people have been left in the middle as different services do their own thing. We've got to bring those services together to wrap around the individual to ensure they've got high quality health, housing, benefits, a real integrated package of support for older people and people with disabilities.
There's going to be increasing numbers of older people. The numbers over 85 are going to double by 2025. The numbers over 100 are going to quadruple. That's going to mean that there will be more people who need access to care and support, so we need to respond to that.
We do have people with disabilities also living longer, which is great, but we also need to make sure that their quality of life is good. So we want to personalise care for people, and we want to make sure that we prevent people getting ill.
The criteria of each organisation is really, really complicated. I'm really lucky that it's part of my job to understand all of those systems and how they work. But lots of disabled people won't ever understand it all.
So one of the big challenges for the future is, can we just make it much clearer what the care and support is that people qualify for, how much they have to pay for themselves and how much is paid for by the state.
If you have to increase the contributions that people make, then do so across the board. We all need to pay for one another's health and welfare in the future.
Money, it all comes down to money. Who's got it, who hasn't got it.
Older people, their families and carers have expected that a social care system would be there for them when they need it, and this, like the NHS, would be an entitlement.
So in the Green Paper, we've spelt out a range of funding options, and those options look at whether there should be a national system or whether there should be a system which is a local system.
If I ever go into a home, I don't want to have to pay for it by selling my house, which I've worked hard for all my life.
You get these huge sort of issues about fairness between generations and within a generation. Those are the things that people are saying, we want policies for the future that sort out some of those unfairnesses in the system.
I would like to see postcode lottery disappear. Depending on where you live, on how much money there is to support you and to get your needs. It's about equal rights, and I would like for everyone to have the equal chance and the same access to the same services.
Our care and support system owes its origins, of course, to the 1948 Act, and behind that to the Poor Law Act, and there is considerable local discretion as to who gets what.
If you look at social care history, in medieval times you'd be very much dependent upon family care, village care, perhaps you'd have support from the church or the lord of the manor, so it'd be very varied. As you move forward, although you can see growing amounts of intervention by government throughout the story, there is still a very heavy reliance upon the importance of the family.
We need a partnership going forward if we're really to tackle what is a huge public policy issue that we face today.
You've got to be committed to reform and seeing it through if you're to open up a debate on this scale, but we are.
But if we work together, if we really do co-produce a new future, then I think the Green Paper could change the lives of everyone in this country for the better.
whatever age you are, whatever your circumstances, the care and support system will affect you. So we need to know what you want from that care and support system. Our call to action is let's get stuck in to creating a 21st century system of care and support that meets everybody's needs.